The government says the reorganisation of any service will inevitably include changes in staff, whether through resignation, non-renewal or termination of contracts. It highlights the GHA had supplemented its existing staff with additional clinical staff to help Gibraltar get through the pandemic. Where they are no longer needed, staff have not been retained. It says the number of reforms made as a result of and since the pandemic, such as the 111 service, should not be dismissed, underestimated or forgotten. In a statement, Minister for Health Samantha Sacramento stressed it is unfair not to recognise the excellent work of GHA staff during the greatest challenge of our lifetime, adding there will be a major announcement on Gibraltar's health services as it looks ahead to a future beyond COVID that will resolve many issues the pandemic has created. Regarding Together Gibraltar's criticism on mental health, the government says the far-reaching improvements have had a direct positive impact on patients. Since launching the 111 clinical triage system on the 26th of July, the service had received 169 calls by the end of October. The Ministry for Health adds the introduction of the crisis pathway has also had a positive impact on the number of available beds in the Acute Admission Ward, which has historically been over-occupied. Now it says it's never more than 70% full and generally runs at 50% capacity. The ministry highlighted the knock-on effect will mean further resources directed towards community support as an alternative to hospital admission, with more beds available at Ocean Views and the elimination of waiting lists at Bruce's Farm. Samantha Sacramento said the GHA is striving to achieve a modern, streamlined and joined-up approach that meets the needs of patients, service users and their families.